Hello everyone, welcome to another session of Next Saviours Essential Question Series for NEET PG 2025. Today we are going to have a discussion on a topic out of which one question is mandatory to be asked, and that is the normal organ histology. That means they will be providing you a slide on the basis of which you have to identify the organ. So let's start with the first slide. Whenever you see this tree-like branching pattern and you have identified the outer and the inner layers, and in the outer layer one is the molecular layer, another one is granular layer, and in between these molecular and granular layer you can very clearly identify there is a large flask shaped neuron with a single apical dendrite extending into the molecular layer. So these are found at the junctions of the molecular granular layer. So this is the large Purkinje cell, which is the hallmark feature of cerebellum in the histological slides. So these are the Purkinje cells, and these Purkinje cells are the hallmark features. So you have identified this slide to be that of the cerebellum. Now another point is that what is this inner layer? This inner layer is that of the white matter, right? Which is centrally located. It contains myelinated nerve fibers and it forms a characteristic tree-like branching pattern which is seen in the cross sections. Hopefully you will be able to identify the cerebellum layer if at all it is provided to you in the question. Next is the identification of the granular structures found in the cytoplasm of the neurons, and it is very easily identified to be the Nissel's granules. Nissel granules are the chromatophilic substance which are basophilic granular structures found in the cytoplasm of the neurons, and a specific strain which is required for these to be identified is a Crescel violet strain, because it is most commonly used to stain these Nissel bodies showing deep violet colored granules. And as far as this structure is concerned, it is nucleus and this one is the nucleolus. So you have easily identified this to be a Nissel granules in the cytoplasm of the nerve fiber. Next is to identify this structure. Now all of you are aware of the fact that this nerve is actually not a single axon. When it is cross-sectioned, then there are multiple axons which are clumped together, and each axon is having its own fibrous covering. So if you identify it in this slide, here we are having the axon which is having its fibrous covering, and this fibrous covering is known by the name of endoneurium. Now there are multiple axons which are clumped together in order to form the fascicle, and this fascicle is further having a fibrous layer, and this fascicular fibrous layer is known by the name of perineurium. So this fascicular fibrous layer over here is known by the name of perineurium. And finally the outermost layer of the nerve is epineurium. So once you have identified these epineurium, perineurium and endoneurium along with the axons, and in between there is a myelin sheath. So this is the myelin sheath. So answer for that question specifically is going to be a cross section of the nerve fibers which is asked for you to identify. Next is what you can see over here are the multiple layers of the squamous cells, and there is no keratin, which is unlike skin obviously. And the basal layer, it contains cuboidal cells, while the superficial layers, they contain the flattened squamous cells. So here there are cuboidal cells on the basal layer, while the flattened squamous cells on the upper layer. So answer for this question is stratified squamous non-keratinized epithelium, and this is a feature of esophageal mucosa, as you already are very well aware of the fact. All right, now esophageal mucosa is very rare to be identified, but it has to be distinguished from this type of the slide. Now here, as you can very clearly see, that there are simple columnar epithelium which are present. These are simple columnar epithelium, but the thing is that there are no goblet cells. That means there are no secretory goblet cells which are present over here. So there is absence of the goblet cells. Apart from this, these gastric pits, as you can see, these are the pits which are extending or invaginations of the epithelium into the lamina propria is there, and there are no villi also, which are unlike intestine, that you can see that in case of intestines, small intestines in particular, there is a presence of villi, but there is no villi in this slide. And there is a presence of the gastric glands which are containing or consisting of the chief and the parietal cells. So the gastric glands are also present. So hopefully you have identified that this is nothing but the feature of a normal stomach mucosa. So this slide is that of a stomach mucosa, and how you have identified the columnar cells without any goblet cells, without any villi, the gastric pits which are present, which is extending, or which are the invaginations of the epithelium into the lamina propria? So answer for this question is normal stomach mucosa. Next organ or next slide that you have to identify is on the basis of the villi. As you can see that there are finger-like projections extending into the lumen which are absent in the stomach, and there are presence of these goblet cells. So goblet cells are present in this case. There are presence of crypts of Lieberkühn which are invaginations in between the villi containing the stem cells and the pennate cells. So the crypts of Lieberkühn are present, and simple columnar epithelium is the lining of the villi with a brush border. So this is the slide of a small intestine, or this is how the small intestinal slides are identified. What are the features that you have to remember is: one, the presence of villi; second, the presence of the goblet cells; the third one is the crypts of Lieberkühn, and the simple columnar epithelium lining of the villi with a brush border. Next is for you to identify this another one or another slide on the basis of which it has to be differentiated from the small intestine. That means what are the key identifying feature of the large intestine? Number one, there is no villi. You see, unlike the small intestine, the large intestine has a flat mucosal surface. So, number two, the presence of the multiple goblet cells. So, the goblet cells are present more numerous than in the small intestine for the mucus secretion. So, there are presence of the multiple goblet cells. Then, the crypts of Lieberkühn, which is deep, straight glands, and they extend into the mucosa containing absorptive cells and the goblet cells. So, crypt of Lieberkühn are also present, and simple columnar epithelium, as we have seen it in the small intestine also, but there is thick muscularis externa that helps in peristalsis. It is a specific feature for the large intestine, and how you have differentiated it from the small intestine, that unlike the small intestine, the large intestine is having a flat mucosal surface. So hopefully you will be able to identify, or hopefully you will be able to differentiate in between the histological slides of the large intestine and the small intestines. Now, these are the slides which are very, very frequently kept in your examination, that how to identify a hyaline cartilage. All of you know that this is the slide of the hyaline cartilage, and how to identify this. You know, the chondrocytes are present in the lacunae. That means these are the round cells which are located inside the clear spaces. So these are the chondrocytes. But more importantly is the glassy homogeneous matrix. You see this matrix over here, which is smooth. It is bluish pink basophilic extracellular matrix with no visible fibers, and there are no visibility of the fibers. Because why are we saying about the fibers? Because in elastic or fibrocartilage there is a presence of fibers, while in case of hyaline cartilage there is absence of these fibers, and more importantly there are no blood vessels. So this is how you will identify a slide of the hyaline cartilage whenever it is provided to you in the question. Next is how to identify the features of the elastic cartilage. Now in elastic cartilage what will happen, that it is densely packed dark staining elastic fibers which are seen in the spatial strain. So how will you identify the elastic cartilage? Are by the elastic fibers in the matrix. You know, these are the densely packed dark staining elastic fibers. So this is one feature on the basis of which you will be differentiating it from the hyaline cartilage. Second are the chondrocytes, which are large round chondrocytes which are arranged in the small groups. These are not scattered, they are arranged in small groups, and they are more densely packed. As you know that this is usually required for flexibility and in resilient structures, like it is found in the auricle of the ear, epiglottis, eustachian tube. So this is how elastic cartilage would be identified. Next is to identify the fibrocartilage. Now it is not very difficult to differentiate it with the previous two. How the fibrocartilage is identified is the arrangement of the chondrocytes in a row. So these small oval chondrocytes are arranged in a linear row within the lacunae, and there are abundant collagen fibers. You know, type 1 collagen, which is very dense eosinophilic fiber in the extracellular matrix, they are abundant in number. So abundant collagen fibers are present in the matrix. And as you already know what is the function, these fibrocartilages are found in the high stress areas like intervertebral disc, the pubic symphysis, the menisci of the knee joint, and on the basis of the histology you will be able to compare it with the hyaline cartilage and the elastic cartilages. So just a quick revision, this is how the hyaline cartilage looks like with the less dense matrix. This is how the elastic cartilage looks like, where where the chondrocytes are arranged where the chondrocytes are densely arranged and it is having a dense matrix, while the fibrocartilage where the chondrocytes are arranged in a row. So hopefully you will be able to identify it and mark the correct answer related to this. Now, multiple of the time this question has been kept in your examination where the mixed endocrine and exocrine glands are present, which contain both islet of Langerhans, that means endocrinic portion, and the acinar cell, that is exocrinic portion. So this is the exocrinic region and this is the endocrinic region. You already know that islet of Langerhans, that means which are present in the endocrine region, they are pale staining, they are round to oval clusters which are scattered throughout and no ducts inside, which helps it to differentiate it from the exocrine acinar, and it consists of alpha, beta and delta cells, but it is highly difficult to differentiate in hematoxylin and eosin strains. While on the other hand are the acinar cells. They are relatively dark and they are pyramidal cells arranged in the acini. They consist of zymogen granules in the apical cytoplasm, which consist of digestive enzymes, and the basophilic cytoplasm due to abundant rough endoplasmic reticulum. So these are all acinar cells. And the ducts, you see, this is how the acinar cells are identified. The duct present in the exocrine pancreas are visible in the exocrine region but not in the endocrine region. They are absent in the islets. So hopefully everything is clear, and hopefully on the basis of this you will be able to identify that it is a histological slide of a normal pancreas. Next, this question also has been asked multiple or numerous of the times, that how will you identify the glomerulus and the Bowman's capsule? You can very clearly identify. You see this structure over here, it is the basement membrane of the Bowman's capsule. So this is the basement membrane, then this is the Bowman's space, and these are the filtration membranes in between, which consist of capillary, podocytes and the basement membranes. So obviously you are looking at the histological slide of the kidney where the glomerulus and the Bowman's capsule has been identified. Now, one more thing is that how is it really possible for us to identify the proximal or the distal renal tubules also? Let's name it as 1 and this one as 2. Proximal convoluted tubule is consisting of large eosinophilic cell with brush border microvilli, but when you have to identify it on a histological slides, it is presenting with a relatively a smaller lumen. So this probably is a proximal convoluted tubule. On the other hand, the distal convoluted tubule is presenting with a larger lumen but with a smaller cell outline in comparison to the proximal convoluted tubule. So this probably is the distal convoluted tubule seen over here. So what are the structures that you can very clearly identify in this histological slide is the Bowman's space, then the Bowman's capsule, then the proximal convoluted tubule and the distal convoluted tubule, and the structures which are present in the filtration membrane. So this is the histological slide of the kidney, normal kidney, revealing the glomerulus and the Bowman's capsule. This question has been asked at least 2 to 3 times in recent 4 to 5 years. Next, whenever you are presented with a structure on the histological slide which appears like the Kerala paratha, so it is a lobulated structure, so it has to be identified as the Hassel's corpuscles. You know what are the hallmark feature of the Hassel corpuscles? That it is found in the medulla of the thymus and it is presenting with the concentric layer of the keratinized epithelial cells, and it appears eosinophilic, that means pink staining, in the form of the whorl. So it is having a whorl appearance, and on that basis you can very easily identify it to be a feature of the thymus. You know, the thymus is involved in the T cell maturation and immune regulation, and one feature which is unique to thymus and help it to differentiate from the other lymphoid organs is that these Hassel corpuscles are absent in the lymph nodes, they are absent in the spleen, and they are absent in the other lymphoid tissue. So on that basis you have identified it to be the histological slide of the thymus gland. Let's talk about the spleen also. As you know that spleen is a secondary lymphoid organ with both immune and hematopoietic function. So it is structurally divided into capsule, trabeculae, white pulp, red pulp and sinusoids. But whenever the histological slide is presented to you, you have to identify the white pulp and the red pulp. How this white pulp is identified? It appears basophilic, that means it appears slightly dark blue in color on hematoxylin eosin stain. As you already know that it is consisting of the lymphoid follicles, periarteriolar lymphoid sheaths and surrounding central arteries, right? On the other hand, the red bulb, it means red or slightly pinkish in color on HNE strain. And what does it contain? It consists of splenic cords, which is known by the name of cord of Billroth also, which is a loose network of reticular cells, macrophages and the RBCs and the splenic sinusoids. So based on the identification of these white and the red pulp having blue and relatively red or pink in color, you will be able to identify it to be a normal spleen histological slide. Now, another very important key finding which they are asking regularly is about the histological slides of the papillae. You know how to identify the four different types. The first one is the filiform. You know, filiform, it is located in the anterior two-third of the tongue and the function is purely mechanical. But how is it going to appear on the histological slide? You can see that there is a slender, conical, heavily keratinized structure. And does it contain any taste buds? So no, there are no taste buds. So peculiar appearance of the filiform papillae on the histological slides on the basis of which you can identify them. Now another one is that if you see a large dome-shaped structure which is surrounded by a moat-like groove, this is a groove which is known by the name of von Ebner's gland. So this is how you will identify a circumvallate papillae. You already know that it is present near the sulcus terminalis and the function is primarily a taste. So obviously the taste buds are going to be presented on the lateral walls. Now another one is the foliate papillae. Whenever you see the parallel ridges like this, so these are the parallel ridges which are more prominent in infants. The taste buds are present on the lateral margins. So this is how you will identify a foliate papillae. The function is again taste. So obviously the taste buds would be presented in this case. And finally, the fungiform. How will you identify a fungiform papillae on the histological slide? Is by the mushroom-shaped, thinly keratinized, scattered among filiform papillae. You can see this is the mushroom-shaped, thinly keratinized, which is scattered amongst the filiform papillae. So it is also contributing in the function of taste. So the taste buds are also present in the fungiform papillae. So this is the table which is comprising of what we have talked about till this point related to these papillae identification on the histological slides. So hope you will be able to identify every slide and hope you will be able to identify and mark the correct answer related to these questions. We are expecting one question out of it. And so all the best for your future examinations. Hope you have found the session helpful. In case you do not want to miss any important update related to your NEET PG 2025 examination, please join our Telegram group. Thank you very much for listening.